Okay, so for the shoulder, we're going to be at a 40-inch SID. We're going to be using a 10 by 12 cassette. And for the first few projections, it's going to be landscape. So for our neutral shoulder, we're going to be centered at 1 inch inferior to the coracoid process, which you can't feel the coracoid process. So if you feel for this just little depression here, that's pretty much where we're going to be centered. So I'm going to come up just a little bit to about here. And you have to include the SC joint as well as the shoulder. So I'm going to move forward just a little bit so that we include all of this. We're still at the same level. So for a neutral projection, you're just going to have the arm just relaxed at the side. The respiration phase for the shoulder is suspended. For an external rotation of the shoulder, you're going to be in the same position, 1 inch inferior to the coracoid process. You're going to externally rotate the hand so that you put the greater tubercle in profile. You're still going to include the entire shoulder and the SC joint. The respiration is still suspended. Okay, for an internal rotation, you're going to turn their hand all the way in so that the back of their hand is against their thigh. Same criteria, you want to include the SC joint and the entire shoulder. You're still 1 inch inferior to the coracoid process. You're going to have them suspend respiration. For a scap Y, or a lateral shoulder, you're going to have the patient just bring their arm across their stomach. You're going to be at 40 inches. This time we're going to rotate our cassette so that it is in the portrait orientation. And you're going to rotate your patient 45 to 60 degrees away if you're doing an AP. I personally prefer AP. A lot of places do PA. Either way, it's a 45 to 60 degree rotation. So for AP, we're going to rotate away. And I like to use a little trick where I feel the superior angle of the scapula and feel for the AC joint. And I put those in a straight line to the IR. You're going to be perpendicular to the head of the humerus. And I'm going to fix my, I'm actually going to come down just a little bit. And fix my collimation so that I'll include what I need. And that should give you the perfect Y with it being superimposed with the humerus. Respiration for this is suspended. For an AP clavicle, we're going to be at 40 inch SID. We're going to use a 10 by 12 cassette. We're going to be landscape because we want to get the entire clavicle. So we need to get from the SC joint all the way over to the acromion or the AC joint. So I'm going to move you over just a little bit. Her clavicle is right here. So we're going to be centered at the mid-clavicular area. So I'm going to move this up just a smidge here, right there. And I'm going to collimate in a little bit. So we're all lined up. You're going to shield. You're going to place your marker in the little bit of light that you have up here. The respiration for an AP clavicle is suspend on expiration. Okay, for an AP axial clavicle, we're going to use a 15-degree angle. It's about there. And we're still going to center at the mid clavicle, which her clavicle is right here. So I'm going to center just below the clavicle because we're projecting everything up. We're going to have SC joint and AC joint. Line my bucky up so that I don't clip everything off. We're going to place our marker in this small area here. For the axial clavicle, we're going to do a suspend on inspiration. So you're going to have the patient take a deep breath in and hold it.